Hello guys, this is me DrKashan Qasit. Today here we were discussing the ECG patterns in which we have discussed in previous lecture about the left and the right atrial hypertrophy. We have seen the ECG patterns in both these conditions. Today we are going to discuss the atrial fibrillation. So basically atrial fibrillation, it is the arrhythmia where the atria beats rapidly, chaotically and ineffectively. So in this condition, actually the phenomena behind is ectopic activity within the atria, or there can be any valvular heart disease or pathology like mitral stenosis, which will be leading to left atrial dilatation or enlargement. Fibrosis can be there, but these reasons will lead structural remodeling of the atria become fibrosed or dilated. This will lead further to the electrical remodeling of the atria. So whenever there is a electrical remodeling in the musculature of the atrium or myocardium, there will be the changes in the circuit that will lead to the re-entry phenomena in the atrial musculature. So this will lead to the atrial fibrillation. So the phenomena behind the atrial fibrillation is all we have discussed earlier, but the atrial rate in this condition will be between 350 to 600 beats per minute. The firing impulse will be ranging between 350 to 600 beats per minute, but the ventricular rate will be ranging between 110 to 140 per minute. So this is the ventricular rate, this is the atrial rate. So whenever atrial rate between 350 to 600 per minute, you will look at the ECG. So the ECG pattern, first of all you will look at the P wave. The P wave will be absent, or there can be a fibrillatory P wave. Second thing you will see is the irregular rhythm. So the RR interval in this condition will be irregular and the QRX complex will be variable. So first of all the P wave will be absent, then there will be irregular pulse or rhythm will be seen in the atrial fibrillation. So the ECG pattern will be like this, in which there will be absent P wave, or there can also be a possibility of the fibrillatory wave seen in the ECG pattern. So the ECG pattern, I will display here some of the ECG patterns of this condition, which is atrial fibrillation. You will get some concept regarding the ECG of atrial fibrillation. So this will be the ECG pattern of the atrial fibrillation. Next, what are the reasons or the causes for atrial fibrillation? The simple mnemonic for the causes of atrial fibrillation is number 1, which is pyrates. You can also go for this one, which is atrial fib. So this P is denoting the pulmonary diseases, I is for ischemia, R is for rheumatic heart diseases, A is for anemia, or there can also be myxoma of atrium, then thyrotoxicosis, ethanol or sepsis. So this is the mnemonic for remembering the causes of AFib. There is another mnemonic, you can also remember this one, which is atrial fib. This is also showing the causes. Number 1 here, it is the A, which is showing the alcohol abuse, or there will be excessive caffeine use. T is again for thyroid disease, hyperthyroidism. R is for rheumatic heart disease, I is for IHD, A is for again anemia or atrial myxoma. L is for lung diseases like pulmonary embolism or emphysema. PH is showing pheochromocytoma. I is for idiopathic cause, can also be there. B is for blood pressure. So these are the mnemonics for remembering the causes of atrial fibrillation. So in the end, I will give you the overview of atrial fibrillation. In the atrial fibrillation, there will be the arrhythmia and the atria will rapidly contracts, beats, and the rate will be lying between 350 to 600 beats per minute of the atrium, and ventricular rate will be between 110 to 140. There will be irregular rhythm, P wave will be absent, QRX can be variable, and there will be the fibrillatory wave which can be seen on the ECG, and these are the mnemonics for remembering the causes of atrial fibrillation. So this was all about the atrial fibrillation. In the next video we will be discussing the atrial flutter, and we will differentiate between the atrial fibrillation and atrial flutter. So hope you like my video. Thank you very much for watching. I'll see you in my next video.